Hello everyone. Today I'm going to be talking to you about brushing, flossing, and caring for your teeth. Did you know, according to ADA, that 75% of the American population has some form of gum disease? Wow, that means most of us have it and we don't even know until we go see a dentist, which is really important why we go see a dentist at least twice a year. Gum disease can form from either the genetics or improper care of the teeth, which is why today I'm going to talk to you about how to properly care for your teeth through brushing, flossing, mouthwash, and other things. So we'll start off with brushing. Brushing, you want to make sure you're doing at least twice a day. Once in the morning and once at night for 2 minutes each. Most of us on an average are only brushing for about 30 seconds, so that's 1/4 of the time we really should be brushing. So we either want to put a timer and make sure we're brushing for 2 minutes, or sing the happy birthday song, or twinkle twinkle little star, or whatever it takes, but you always want to make sure you're doing it for at least 2 minutes because you're not effectively removing all that plaque and bacteria if we're doing it for less. Another thing you want to make sure you're doing when you're brushing is using a soft-headed toothbrush. There are medium and hard bristle toothbrushes out there, but you never want to use those because those are going to wear away your enamel and your gum tissue. Another thing you can use is the electric toothbrush. The electric toothbrush is actually doing all the work for you, which is really nice. But one thing you want to make sure you're doing with the electric is only moving it from tooth to tooth, and then on the insides and on top of your teeth. Because if you are doing the brushing motions, it's going to do the same thing the medium or hard toothbrush would have done, which is wearing away the enamels and the gums. So you can get the electric. The only thing you want to do is make sure you're moving it around in your teeth and you're not doing any brushing motions with it. Another really important thing that we should all be doing, and most of us don't do, is flossing. Flossing is going to help keep that bacteria out from underneath the gums. So we want to make sure we're flossing at least once a day, preferably at night, because when you're eating throughout the day, all that food and plaque and bacteria get stuck underneath the gums, and then we're going to sleep with all that plaque in our mouth. When our body's sleeping and at rest, it's not going to fight off that plaque and bacteria as good as it was when we were awake. So that's why we always want to make sure we do it right before we go to sleep. Otherwise, all that plaque and food gets stuck in there for 6 to 10 hours, depending on how long you sleep. So it has all that time to sit there and start the gum disease and inflammation process, which is really important why we start flossing. You can use the floss picks, which is fine. Everyone has their own preference, or the regular floss. The only thing is you want to make sure you're going in between the teeth, pushing the floss to the side of the tooth and going down underneath the gum, because if we're not getting underneath the gum, we're really not going to get anything out or prevent that gum disease that's going to start. So a lot of people will come to dentists and be notified that they do have gum disease and say, oh, you know what, I am flossing, I do it every day. You just might not be doing it the right way, which is what can also cause gum disease. Another thing we want to make sure we're doing is you don't have to do, but you can use mouthwash. Mouthwash is an antibacterial that helps keep that plaque and bacteria out as well. As long as you're brushing and flossing, it's not really necessary, but everyone has their own preference. If you are going to use a mouthwash, you want to make sure you're not using Scope. Scope is just a breath freshener, which has a lot of sugar in it, so it's actually going to harm you more than it's going to hurt you. So what you want to do is get either Act, which has fluoride in it, or Listerine and Crest Pro also have fluoride in it. Anything with fluoride in it is going to help prevent cavities. You don't need to have fluoride in it because all the other mouthwashes are actually antibacterial. So unless you're not looking for that, it's fine. There are also tooth whitening mouthwashes, it's just your preference, whatever you want to use. Another thing that a lot of people don't do that they should do is brush their tongue. A lot of people have plaque sitting on their tongue, either from coffee or from smoking or from whatever it is, and they're not brushing their tongue. So what you want to do is either take a regular toothbrush, push it all the way from the back of the tongue, and just bring it down, sweep it down. There are also tongue scrapers out there that you can use they're kind of like U-shaped horseshoe, and you just put it all the way on the back of the tongue, and you just bring it all the way down. So those are mostly the main things that are going to help you keep your teeth from having gingivitis, your gums from having gingivitis, and your teeth from forming cavities. So again, you want to make sure you're brushing twice a day, flossing at least once a day, optional to you if you want to use mouthwash, and make sure you're brushing your tongue. And those will be the key things, like I said, to help you prevent from gum disease and cavities. Thank you for watching.